So what can you do for yourself so that you don't end up in surgery with those obviously extreme situations? Keep your nails trimmed. That's pretty basic. Wear your clean socks that allow airflow. So your socks are super important. Change them a couple times a day, because remember, if you're a diabetic or you have a family member and if they have autonomic neuropathy or a sensory motor neuropathy, they don't sweat right. Their skin changes too much. They get dry, cracked skin. So you got to keep it clean, keep changing the socks to regulate the moisture levels. Inspect your feet daily. We already talked about that. Wash your feet daily. Monitor your eating habits. And what I mean by that is try to avoid highly processed foods that induce inflammation. So if you had to pick between, let's say, a peanut butter sandwich and Cheetos, you should pick the peanut butter sandwich because Cheetos are highly engineered, highly processed foods that induce inflammation. The more natural foods, the closer to how they look when they come out of the earth, the better. Avoid smoking. Smoking is probably the worst thing you could ever do in general to yourself, but especially if you're diabetic with neuropathy. So that kind of goes without saying. Smoking kills almost 500,000 people in this country every year and has done so year after year after year. I don't know why we're okay with that, but if you are diabetic, I just beg you, please quit smoking. And there are meds we can give you to help with that. Refrain from inflammatory things like alcohol as much as you can. Most importantly, if you think you have diabetes, pre-diabetes, or you do, just make sure you go see someone, your primary care, nurse practitioner, even a physical therapist, just go see somebody and make sure you're in touch with a professional in the healthcare environment that can guide you if you start developing a pretty bad problem, okay?